We have all, I feel like, learned about is private equity's role in healthcare. It's a fierce debate right now. We've seen bills on Beacon Hill. Nothing has made it across the finish line. What do you want to see happen here? Should private equity continue to have a role in healthcare?
You know, I might take a position that you might not expect me to take because of what we've just been through, but I think that, you know, the word private equity, substitute private equity for Bank of America. Hospitals are capital-intensive resources. They need investment dollars. I think that any blanket statement doesn't make sense, and particularly in a state like Massachusetts, where we have had this life science infrastructure that's funded by venture and private funds. And so you
think private equity does have a role in healthcare?
I think that private equity is a mechanism for people to access capital, and we have a healthcare system that has to change. It has to innovate. We have to find better ways to serve people.
You don't think it's a dirty word in a hospital care?
I think that it was done really badly at Stewart, and it was not just private equity, but real estate investment trusts. There were a number of capital vehicles that were really challenging. Right. But I think that we you know, the legislature, I think, is right to take their time to understand the complexities. Healthcare is 20% of the GDP in this country. We have to really think very carefully about how and when we interrupt this system.
What about guardrails? Do you think there should be
Yes,
guardrails?
I think there should definitely be guardrails.
And so do you think Beacon Hill should act on some of those then?
I'm not going to comment on pending legislation. That's been drilled into me in this role, but I think that we have to watch how investors enter the healthcare market and very specifically how they exit.